Hello students, welcome to this new semester. And I would like to also welcome you to this new course, English for Nursing Advanced. Well, in this video, I would like to explain everything related to English for Nursing Advanced. There are several key points that I would like to highlight. The first one is the course description. The second one is related to the learning activities that we are going to have. And finally, we would like to discuss the class policy that we are going to have for the whole semester. Now, let's discuss the course descriptions first. So, what is English for Nursing anyway? English for Nursing course covers familiar topics in nursing context, which is addressed to pre-intermediate nurse students who can understand the whole essence of a conversation and produce more complex expressions. This course is also designed to help you to be able to communicate in English at the operational level and to improve your English mastery according to biblical Christian worldview. Therefore, during the course, you will enhance your critical thinking and also reading skills by analyzing the language features of model dialogues given based on certain clinical settings. You will also practice the dialogues with your classmates to improve your communication skills. As the reinforcement of speaking skills, you will be given an opportunity to plan, develop, and evaluate your own dialogues about asking and giving information with patients in particular contexts, such as explaining simple steps in nursing practices, giving information about pain management, handling patients' complaints, breaking bad news, and showing empathetic response to the patients. In addition, you will create and practice dialogues involving fellow medical professionals, such as introducing yourself to each other, asking and giving information about bedside handover, and discussing drug administrations. Thus, this course becomes one of the basics of your community services in the future. In other words, this course prepares you to be able to be a more professional nurse in the future. To summarize, English for Nursing Advanced is for nursing students with pre-intermediate level of ability who wish to communicate and improve their mastery and confidence to operational level in general nursing context. So, at the end of the course, you're expected to be able to start communicating in English at pre-intermediate operational level about familiar topics in nursing context. However, this course has also specific learning objectives, which are number one, record language expressions used in model dialogues with patients and fellow health professionals. Second, discuss model dialogues about asking for and giving information with patients and fellow health professions. The third, practice model dialogues about asking for and giving information with patients and fellow health professions. Number four, plan your own dialogues about asking for and giving information with patients and fellow health professions. Number five, produce your own dialogues about asking for and giving information with patients and fellow health professions. And the last one, evaluate your dialogues about asking for and giving information with patients and fellow health professions. So we will start with a very basic objective, which is recall the language expressions. It means that you are going to analyze the language expressions used in model dialogues that will be provided. After that, you discuss the model dialogues, you practice the model dialogues, and then you plan your own dialogues. Finally, you produce your own dialogues based on the plan. And the last one, you evaluate the dialogues that you have made. All right, now let's discuss our roles. Your roles as students, you need to manage your time wisely. Remember that this is online learning. This is an emergency remote learning and also teaching. That's why you need to manage your time very wisely. The second one, you need to access and also learn the materials provided in Learn. The communication will still be done via WhatsApp group. That's why you need to manage your time wisely to access and also learn materials. And finally, you need to plan, prepare, and submit assignments. Those are the roles of students. Now, I would like to explain my role as the lecturer. I need to present the materials for you. I need to guide and facilitate you during the learning process and also discussion. And the third one, I need to give feedback for improvements. Okay, these are the menus that we are going to have for the whole semester. In the first week, which is this week, we are going to discuss the course description. In the second week, the topic will be about meeting the hospital staff. And then the next one is about I am your nurse, followed by describing a process, for example, about wound care. And the next one will be about describing a system, for example, respiratory system. And then we would like to talk about the bedside handover. And finally, in week 7, we would like to have quiz number 1. And in week number 8, we would like to have the midterm test. After the midterm test, we will discuss drug administrations, followed by pre and also post-operative cares or pre and post-operative checks. And then you will have handling complaints, breaking bad news, and discharge planning as the last topic to be discussed in this course. And in week 14, you're going to have the second quiz, the review quiz. And finally, in the last week, which is week number 16, you will have the final test. Okay, these slides explain how you are going to be evaluated. There are 4 components that I will use to evaluate your performance in this course. The first one is Cut 1, which values 10%. Cut 1 includes 10 different weekly tasks. So you are going to submit 1 task per week. If you submit 1 task, you will get 1 point. If you submit 10 tasks, you will get 10 points of your overall score. I think it's quite easy. The purpose of Cut 1 is to test your perseverance during this course. And the second component will be about quizzes, which values 20%. 1 quiz will be conducted before the midterm test, and the other quiz will be conducted before the final exam. And the third component will be about mid-exam, which values 30%. The midterm exam will be about speaking test, so that's going to be role play. It's quite similar with the final exam, speaking test, role play, but the values for the final exam will be 40%. More or less, it's the same or quite similar with the ones that we have in General English Advanced course. Okay, we have just finished discussing the first topic of this video, which is about course descriptions. Let's summarize. The first one, this course is about English language communication skills in nursing context. The goal of this course is to understand and also use pre-intermediate level of English in nursing context. And we have different role. My role as the lecturer is to facilitate you, and the role of you as the students is to actively participate. And we have also touched several main topics to be discussed in this course. For example, it's about meeting hospital staff, meeting your patients for the very first time, bedside handover, pre and also post-operative cares, until discharge planning. There are 4 components to be used as the evaluations techniques. The first one is cut 1, values 10%, cut 2, values 20%, midterm test values 30%, and finally final test which values 40%. I hope you can enjoy yourself in this course. You can find the pleasures of learning English for nursing so that you will feel prepared or more prepared, more ready to become a professional nurse in the future. Okay, now let's discuss the learning activities that we are going to have in this course. In order to facilitate you, I have prepared several learning activities that we will do in this semester. The first one, we need to communicate via WhatsApp group. So make sure that your WhatsApp number is active. And the second one is you need to watch the video. You sometimes need to do the entry quiz before you can access the materials in the following weeks. And you need to do the daily or weekly tasks. You need to actively participate in the discussion forum. And you need to do the role play. You need to make a video with your friends and post it to our Facebook group. And if possible, we will do an online game during our course in this semester. Hopefully, by having this kind of learning activities, we can achieve the learning objectives of this course. Okay, now let's set the class policy. There are several concerns that I would like to bring related to the class policy. The first one is the attendance. You may be absent, but you are not allowed to be absent more than 2 times. Unless you're not allowed to join the midterm and also the final exam. It means you are kicked out from this course. The second one, you need to wear proper dress, especially when we have Zoom meeting, when we have mid-exam or the final exam. The third one is related to the device usage. I understand that doing teaching and learning during this pandemic is quite challenging. If you have problems with your internet connections or your device, please let me know in advance so that I can help you better. The fourth, you need to come on time. And the fifth one, you need to participate actively in this course. Yeah, I hope that you can really understand that you need more practice, that you need to be brave to make mistakes. You need to be brave to try. That's why active participation is really encouraged. The next one, you need to turning in assignments on time. Unless you will get a penalty, your score will be reduced or you will get the score deduction. And the last one, you need to complete all assignments that I ask you to do. If the assignments is not going to be scored, for example, the assignments for the speaking practice, you still need to do that. Yeah, you still need to complete the assignments. This is the end of this video. I hope you can understand this course better. If you have questions or if you have any concerns, we will discuss it during our Zoom meeting. See you, everyone.